Hi, good evening. My name is SRIVATHSAN NALLUR. I'm a dispensing audiologist based in California, USA. I'm also a licensed speech pathologist in California. So let me share a little bit of my experience with cochlear implants and rehabilitation part of the CI. As an audiologist, I did not have a clinical experience either with mapping or working with candidates with CI. However, working as a speech pathologist, I did have the experience working with two students in the school-based setting who were designated to receive speech therapy. So yeah, I can talk a little bit about that. Yeah, so the first student that I did work, I'm currently working, is a 10-year-old child. She was born with severe to profound bilateral hearing loss, and the student pretty much used sign language up until the age of 5 years. At the age of 6 years, the family decided to do CI surgery, but they didn't go about doing simultaneous CI. So they first chose to do the implantation in the right side at the age of 6 years, and then at the age of 7 years they went about doing the implantation in the left ear. And then the student picked up some amount of speech and language. Currently the student is 10 years old. Between the age of 7 years and 10 years, the child received a variety of support services in the form of AVT, auditory verbal therapy, plus since the student is a student of the public school, she received what we call an IEP, individualized educational plan, which is a unique individualized program with goals for students with special needs. So the student, in this particular student, is identified and diagnosed with a learning disability. She has hearing impairment, speech impairment. So because of all these services, all these disabilities, the student receives a wide variety of services, namely AVT, speech therapy. She also receives occupational therapy. She receives one-on-one counseling due to some behavior concerns. The student has progressed pretty well in all domains, namely academic progress in speech and language. Now the student is able to form sentences and speak in sentences. She could comprehend a short passage and a paragraph, a 2 to 3 sentence passage, and she could answer 4 out of 5 questions correctly. However, the student still has articulation errors. She drops the final consonants. Blends are a little difficult for her. The overall speech intelligibility could be anywhere between 60 to 70%, with a lot of factors. When the rate of speech does increase, the clarity does drop. Nevertheless, the student has a pretty good social interaction skill. She is able to interact with children in the regular classroom. She does have good fine motor and gross motor skills. She participates in dance, cheerleading, and the regular physical education activities. The parents are pretty pleased with the progress. However, the services are ongoing at this time. Typically, here in the US, when a student has an IEP, till the team decides the student no longer qualifies to receive the special education support, the special education services continue until the age of 21. So that's my, in brief, my experience with this particular student with CI. Having the background knowledge in audiology and speech pathology, it really helps me to integrate both professions and both domains to help students with communication disorders. So I hope this was helpful, and good luck to all you guys. Thank you.